Hi, I'm Mike Hansen, Director for the Agency for Persons with Disabilities. I'm here today to try to give you a brief update on what happened during the most recent legislative session, which concluded last week. There are a couple of things I want to talk about in terms of what happened during the session. First, I'd like to discuss the budget, and I think we had a significant success with the budget for the agency. In terms of the waiver program, the Medicaid waiver, which is the main portion of our budget, the funding for the current year, for the 11-12 fiscal year, for that waiver was $810 million. The governor, in his recommended budget, recommended that that be increased to $832 million. The budget that passed the legislature contains a total amount of $877 million, which is about a $67 million increase over the current year's budget. And I think that's a very nice increase that we can use to try to cover some of the shortfall that we've had with our program in recent years. A second element of the recommendations from the governor and that the legislature considered was funding to cover our current year deficit. We have a deficit from the 10-11 fiscal year of about $10 million, and we're still trying to determine what the deficit's going to be in the current fiscal year, but we think it's going to be about $30 million. The total funding that the legislature gave us for to cover those two deficits was $20 million, and I'm talking about general revenue funding at this point. So we're probably going to be about $20 million short in terms of having enough resources to cover our current and previous fiscal year deficit. In order to try to cover the total amount, that means that we'll have to take some of the money that we got for next year and use that to cover some of our current year deficit, which means that we will not be able to fully utilize that total $877 million. I guess the watchword is we still need to economize to the extent possible so that we can balance our budget, and hopefully going forward after next year we will have eliminated the deficit and we will be spending only those funds that were appropriated for this program. There was another element that the legislature did in terms of our budget, and that is for administrative costs for headquarters and for our area offices. They took about a 10% cut to our budget, which equated to about 67 FTEs. So we've got to figure out a way to implement that reduction. One of the things that we're doing, and we've talked about this in the past, is we are going to try to reduce the number of area offices that we have. The Agency for Healthcare Administration has done that. Department of Children and Families has done that. So we are developing a plan to reduce the number of area offices that we have now to a number that's equivalent to what Children and Families has and what Agency for Healthcare Administration has. We hope to implement that by July 1, 2012, the beginning of the next fiscal year, and so we're in the process of putting that together. We also took some reductions in next year's budget for our individual and family supports program and for our room and board program. So all told, we did have some reductions. If you look at the total budget, though, for the Agency for Persons with Disabilities, comparing next year's budget to the current year budget, the legislature gave us an increase of about $60 million. Our total budget is about $1,074 million. So we're very pleased that we got this increase. Of course, this is all subject to the governor's vetoes. There were some projects in our budget that the governor will be looking at, and we don't know what the final decision will be on those. But we did have a very good year, I think, in terms of the budget. A second issue that we were working this legislative session was some legislation to try to help us implement the I budget and deal with some other issues that we faced here in the agency. There was a bill in the Senate Bill 1516, that was sponsored by Senator Negron. Fortunately, that bill did pass the Senate. It passed on a 40-0 vote, and we're very pleased about that. It passed on the last day of session. Unfortunately, it did not pass the House. The House Health and Human Services Committee actually did their own proposed committee bill, and it passed out of their committee that did many of the same revisions to the statute that Senate Bill 1516 did. But unfortunately, that bill never passed the full House, and so we were unable to get any statutory changes for our program. However, even though those bills did not pass, we are still going to move forward with implementation of iBudget. We believe we have the statutory authority in the current law to do that. We've already implemented iBudget in areas 1 and 2, which is the northern part of the state. We are next going to move to the northeast and central part of the state. We're working on doing that now, and we plan to have iBudget fully implemented by the end of next fiscal year, or fiscal year that ends June 30, 2013. I just want to take an opportunity to thank all the folks that helped us this session, our stakeholders, the Family Care Council, providers were all very helpful. They worked with us on the budget, they worked with us on the legislation, and I think we have a product that was very a consensus document from all parties. I think there was a lot of agreement on the document, so I appreciate all the assistance we got from everyone. And I want to thank all the staff of APD who really worked very, very diligently to make all this possible.